Healthcare constantly evolves. But if the healthcare industry has learned anything over the last several years, it's the necessity of being nimble, to pivot to meet the changing needs of individuals and communities. Whether the focus is toward delivery of preventive care, management of chronic health issues, or broader priorities such as improving population health, leveraging new technology for patient engagement, or driving health equity through culturally relevant strategies, we know that community and individual health outcomes are improved when providers stay adaptable. San Joaquin County has for decades met changes in healthcare delivery in part through the contributions of its primary care clinics. Since 2010, tens of thousands of residents have accessed quality care through our county's publicly sponsored safety net clinics. Still, we know more can and must be done to meet the primary care needs of our community's vulnerable residents tomorrow and beyond. To better position for growth in our region and to strengthen our delivery model, we're proud to announce that San Joaquin County Clinics has become an independently managed nonprofit health center. We're now SJ Health. Not just a new name, our new identity is part of a restructuring that includes programmatic and financial independence from San Joaquin General Hospital. It opens the door for nimble execution of our strategic plan and deployment of new care initiatives. It also allows our delivery model to access and leverage new federal and philanthropic funding to bring additional resources toward community health improvements. Led by our independent governing board comprised of patients and professionals with diverse backgrounds, and under the direction of an experienced leadership team, our committed physicians and care team members are aligned to pursue SJ Health's vision and mission and to position us as a valued partner in the continuum of care in our region. Our vision: we envision healthier futures for those we serve, enabled by nimble, adaptive, and progressive care delivery. Our mission: to drive sustained health improvement for San Joaquin County's diverse community through individual engagement, community partnerships, and high-quality, equitable healthcare delivery. SJ Health's restructuring affords us the opportunity to build and strengthen our brand and culture by investing in staff and strengthening internal operations, all to better meet our commitment to patients at our 6 health centers. We're cultivating a renewed sense of pride in our work, driven by our values and our deep understanding of our community's health needs. So how will you see SJ Health in our community? We're positioning to have a larger impact for our patients, to increase our relevance in the community healthcare system, and to fully engage in community health initiatives. We're vested in our vision of healthier futures for those we serve because those we serve are family, friends, and neighbors. We're exploring opportunities to expand our programmatic and payer partnerships to serve residents as they migrate off and on various coverage programs and through the continuum of their health journey as they move through life's various stages. We see opportunities to expand our ability to care for our patients as they become eligible for Medicare as older adults. We're committing to improved equity, including meeting our patients and community residents where they need to be met. Often that's at home, in their neighborhood, at housing shelters and camps, or at the sites of trusted partner agencies. We're expanding our efforts to bring healthcare within reach and make it more accessible than the traditional clinic model. Patients will find access to advanced technologies and emerging tools and resources, including telehealth, virtual consultation, and extended hours. Our patient portal makes communication, appointment scheduling, and medication refills easy and convenient. Our remote patient monitoring technologies save lives in high-risk patients with diabetes and heart failure. We're deploying our mobile health center into the community to bring primary care and behavioral health into underserved neighborhoods and school-based partnership sites. And we've already begun to engage in some of the grassroots initiatives throughout our service area that are already focused toward improving outcomes related to diabetes, prenatal care, asthma, oral health, and other areas of health disparity. We're excited by our plans to further develop digital health promotion through our social media platforms, new e-newsletter, and streamed virtual health sessions. Adoption of new technologies, digital tools, and resources also enables our teams to reduce administrative inefficiencies and direct their passion and focus on our patients. We're engaging in our community's response to COVID. We're proud that our team has led efforts to bring critical services to underserved and vulnerable communities, testing over 100,000 residents through 2021 and delivering over 70,000 vaccinations. Services that were critical toward enabling our community to obtain recommended treatment, to work, to study, to gather with loved ones, and perhaps most importantly, to have peace of mind as they navigated the pandemic. We're prioritizing improvements and efficiencies in our patients' access to care. Prior to the pandemic, many of San Joaquin County's health indicators, such as diabetes, asthma, and hypertension, demonstrated critical disparities from state and national averages. More concerning, many health trends identify inequities that reinforce that some of our most vulnerable and hard-to-reach populations are experiencing challenges in accessing primary care. We know that we'll now need to effectively engage our patients to quickly deliver delayed preventive care, address social determinants of health, and remediate gaps and inequities. We're launching SJ Health's new identity layer by layer to engage our staff, clinicians, partners, and the community. Physically, we're updating our brand and marketing efforts, facilities, and communication tools. More importantly, relationally, we're reaching out to leaders in the local healthcare, business, faith-based, and nonprofit communities to identify and explore opportunities to improve the health of those we mutually serve. We know that we cannot meet our vision alone. With tens of thousands of area residents served by our centers, their health and wellness intersect with our community's objectives to improve economic vitality, education, safety, housing, and overall quality of life. We hope you'll be inspired to find ways to collaborate with us toward larger impacts. We're changing the way we've done things in the past to meet our community's dynamic demands in the future. We're building our patient-centered approach and strategies to meet the needs, preferences, and expectations of the diverse patients we serve. We're harnessing new tools and resources to make health access easier, to broaden our reach, and to simplify the patient experience. We're collaborating and engaging because we know that together we can accomplish more. We're SJ Health, and we invite you to be an integral part of our commitment to a healthier future for those we serve.